NBC 10 at Issue starts now.
People still die from measles.
The worst measles outbreak in decades has sparked debate over immunizations. The argument now centers around personal freedom versus public health. This morning we'll discuss the history of vaccines and why some parents are skeptical.
I hope that parents make the best decisions for their own kids.
Plus, sports betting. Who wins and who loses if it becomes legal nationwide? And a new healthcare deadline is days away. Failing to enroll could cost you big bucks.
Good morning, I'm Jim Rosenfield, and welcome to NBC 10 at Issue. And we begin with the controversy over a childhood disease that many health officials hoped was on its way to extinction. But a recent measles outbreak that began in Disneyland has now spread to more than 100 people across the U.S. And now it's turned political. While on a trade trip to England, New Jersey Governor Chris Christie said parents should have some choice when it comes to vaccinating their children against measles. His comments came after President Obama urged parents to get their kids immunized.
There is every reason to get vaccinated. There aren't reasons to not get vaccinated.
Are you telling parents you should get your kids vaccinated?
You should get your kids vaccinated.
It depends on what the vaccine is, what the disease type is, and all the rest. And so I didn't say I'm leaving people the option. What I'm saying is that you have to have that balance.
Christie later backed off his remarks, then refused to say more. Medical experts overwhelmingly agree that vaccines are safe, but some worry the political backlash makes that message harder and harder to sell to the American people. Well, with me now is Carrie Youngdahl. Carrie is the director of the History of Vaccines at the College of Physicians right here in Philadelphia. History of Vaccines, an interactive website created by the College of Physicians to help people understand vaccines, how they work, and their role in improving public health. Carrie, thanks for being with us here on At Issue this morning. The rate of vaccinations in our area seems pretty high, and yet we are seeing them dropping in some areas. Why do you think that is?
Right. We see the rates dropping, especially in places like California. California has a pretty easy way to get around vaccine requirements, and some parents are choosing not to get those vaccines, I think because they don't perceive a threat to their children from the vaccine-preventable diseases.
And how realistic is that perception?
Well, we see it's not realistic now because certainly a lot of people have been put at risk in this measles outbreak, and we're hearing anecdotally reports of a lot of parents who hadn't vaccinated their children taking them in to get their MMR.
What do you say to parents who worry that the measles vaccine can harm their children?
I would say let's listen to what the CDC says, let's listen to what the American Academy of Pediatrics says, and the WHO, and they're all saying that the vaccine has a great safety profile and is very effective.
What's the risk if more and more parents decide, well, this isn't right for my children and I have the right to make this choice?
Right.
What could happen?
Right, sure. The risk is that we would have measles transmission ongoing in the United States again. You know, right now it's a pretty contained outbreak because it just hasn't spread very far. But if more and more people are exempting their kids, then we could see these chains of transmission that go on for a long time, and we want to avoid that.
And some states do have vaccine exemptions, correct?
Sure. Almost every state has a medical exemption. So if your kid has a contraindication to getting vaccinated, that kid doesn't have to get the vaccine for school entry. Many states have religious belief exemptions or personal philosophical belief exemptions. That's all tied to school entry.
Can you explain to us briefly in layman's terms why these vaccines are important to get, how they work?
Right. So vaccines are one of our greatest public health preventive measures, along with kind of safe drinking water. Vaccines give the body a tiny dose of the illness or the pathogen that then trains the body to recognize that pathogen in the future if it encounters it in the wild. So we prevented hundreds of millions of diseases in the 20th century through vaccination. And we wiped out smallpox, which was a terrible disease.
And yet we do have the so-called anti-vaccination supporters and people who feel strongly that despite what President Obama says, the science is clear, that they don't believe that it is in fact safe. Has their approach changed?
You know, it's interesting because I've studied this at length, and we talk about this at length on my website. I think that anti-vaccination happened as soon as vaccines were developed. So we've seen many of the same arguments used throughout the years. There are personal liberty arguments, there are risk arguments, and there are religious arguments. And I don't think they've changed that much. I think some of the details have changed.
Are you seriously concerned that if more and more people opt out, we're going to have a serious problem once again with diseases like measles?
I think that we are doing a really good job in the United States with our vaccination program in general. In general, we have really high rates, and what we have now are these little pockets of exemptors. I think that this measles epidemic or outbreak is going to help get a lot of people vaccinated who had refused the vaccine before. You know, historically, we've seen this happen. In New York, there was a smallpox outbreak in 1947. 6 million people got vaccinated within a few weeks because of that. When people perceive a risk, they take action. And I think people are taking action now.
All right, Carrie Youngdahl, we appreciate you being here today on that issue.
All right, it's great to be here. Thanks.
The Centers for Disease Control recommends 2 doses of the measles, mumps, and rubella vaccine. The first when a baby turns 1, the second around kindergarten. An analysis from the Trust for America's Health finds states in the Northeast have the highest vaccination rates, none below 90%. The lowest rates are in Colorado, Ohio, and West Virginia at 86%. In Pennsylvania, the vaccination rate for the MMR vaccine is 93.3%. In New Jersey, it's 95.6%, and in Delaware, 94.8%. Nationwide, the CDC says 94.7% of kindergartners across the country have been vaccinated. And with me now is Honey Rinicella. The number of parents, as we hear, who vaccinate is high. The parents who don't vaccinate say they have good reasons. And Honey believes her twin sons developed autism because of vaccines, and she says parents who don't vaccinate are being unjustly bullied. Honey, thanks for being here this morning on At Issue. We really appreciate it.
Thanks for having me.
You call the anti-vaccine critics atrocious. Why?
Well, first of all, we're not anti-vaccine. I mean, if my child were allergic to penicillin, it wouldn't make me anti-penicillin. It would make me pro-safety for a child that's allergic to penicillin. So children like my own, we obviously aren't anti-vaccine. We did the vaccines. We took our kids to the doctor. We followed the recommended protocol. What we're trying to say is there is no one-size-fits-all in medicine. There is no universal in medicine. We need to individualize these programs to fit our children, to regain the trust of the parents. I fully support vaccinations. I do. But they need to be safer. Regarding the measles outbreak in California, the OC, Orange County Register, just announced last week that of the 60 measles cases, they have confirmed that 29 were in fact vaccinated. In 2012, the NIH came out and stated that the vaccine was not necessarily going to be covering kids long term. The vaccine's not working. If 50% of the population out at Disneyland was vaccinated, it's hurting my population that can't get vaccinated and the population that is. It's not working. The system's broken.
But if you take the next step and say, well, the vaccine isn't working, so we all shouldn't get the vaccine, or should parents still be protecting their children against a potentially deadly disease like measles?
Well, first and foremost, you can pull it tighter to see if you even need the vaccine. I mean, I have twins that are immunocompromised, so my kids aren't actually supposed to be around people that have vaccines because they virally shed, and my kids could actually catch. That's Johns Hopkins has actually suggested that you can't be, aren't they cute?
Adorable voice.
Yes, that was after they had a vaccine reaction. They were happy and bubbly, and then I lost them.
And how do you make that connection to the vaccine as causing autism?
I didn't make the connection. The doctors did. And what we had found through various tests, because they had such a significant regression, was that they had an underlying mitochondria dysfunction. And there within that issue lies a lot of the problem with these families. Again, I'm pro-vaccine, but I need parents like myself to be heard. Had they tested my children prior to inoculating them and following the one-size-fits-all schedule, my kids would not have a lifelong disability and they would not be mentally brain damaged for the rest of their life, left on, you know, my back and the back of yours, the taxpayers, to care for after I die.
We've heard President Obama say it, we've heard doctors say it, that the science is clear. Hillary Clinton tweeted it. Vaccines do not cause autism, they say. And Autism Speaks, a leading autism advocacy group, says the measles vaccine is safe. Parents should get their kids vaccinated. You don't agree?
No, two things. First off, 1,500 cases of measles over the course of the last decade. 1,500, not one death. This is the great thing about Western medicine. We have fabulous doctors now. We know that the measles can be taken care of with vitamin A. It actually attacks the virus, and it's a treatment. There has not been one death from the measles in the course of a decade with those 1,500. However,
globally there have been.
Globally, we're talking about the United States here. Yes, that's an issue in and of itself. We're talking about the United States. However, of those 1,500 vaccine cases with 0 deaths, in that same time period, there have been 80 plus deaths from the measles vaccine.
Is it directly correlated to the vaccine,
Absolutely, and it's in federal vaccine court. It needs to be researched. It's not on the CDC's website. President Obama needs to look into this. So does Hillary Clinton. There's a vaccine adverse reaction system.
But does it correlate it to the actual vaccine?
Absolutely.
I'm not sure that that's what the science says.
It does. It doesn't trigger, it's not correlating the autism vaccine link. Those cases that have gone into the federal court of claim, which there's 83 of those, by the way, I'm one of those that has a case. So if you have a federal court of claims case, there have been 83 cases in the federal court of claims that have paid out that they have triggered autism-like symptoms. So my children suffered encephalopathy from their vaccines. Well, encephalopathy is a component of autism. Autism is generally a comorbid condition that has a lot of underlying medical issues. Seizures, encephalopathy, speech issues, GI issues. So those are all components of what the vaccine can hurt. That's what happened to my children. You're not going to go and look it up and it's going to say vaccines cause autism based on the payout. What you're going to see is those federal court of claims paying out that the triggered symptoms of the autism that caused the autism were what they were paid out for.
Honey Renicella, your boys should be proud of you because you advocate so well for them, and they are adorable, and we appreciate you being here on that issue
Well, thank you
this
for
morning.
having me.
Appreciate it. Well, if you placed a bet on last Sunday's Super